Hi, my name is Lauren Friedman, and today I want to talk to you a little bit about your Crohn's disease diagnosis and what we can do and better aid you and assist you in the resolution of your symptoms, because this is considered an autoimmune disease and it can be a lifelong condition, and it typically comes episodically. So, Crohn's is in the category of an inflammatory bowel disease that affects the lining of your digestive tract, and it can affect all the way from your anus to your esophagus. It can be anywhere along that line. So don't be surprised if you do experience GERD, chronic diarrhea, pain in your lower abdomen and your upper abdomen. But most people do have pain in their lower right side, which would be considered their terminal ileum. That is typically where Crohn's disease will manifest itself. And I see today on your intake form that you are experiencing abdominal pain, diarrhea, blood occasionally, fatigue, and weight loss. And these are all really normal symptoms of Crohn's disease. Also, a lot of malnutrition because you're not absorbing your food properly. So this can really cause a lot of low energy and anxiety. Anything involved in your gut can kind of bring on a whole host of symptoms. And you've mentioned that this has been going on for several months and varies in intensity depending on your stress levels. And certain foods do tend to worsen your symptoms, like spicy foods and alcohol. But you do seem to have resolution with a bland diet and rest. So that gives you some relief. And your job does include a high stress environment, and going out socially does seem to trigger this. So really, I want to kind of do some additional testing to make sure we have the correct diagnosis and to make sure that you are where you are in the disease progression. So something like getting a CBC to check for anemia and other infections, because sometimes Crohn's disease can be, when they can't find anything else, they'll kind of throw an autoimmune diagnosis on it. So there could be a parasite, there could be something else, CRP to look for inflammation, and then a fecal calprotectin test to assess the inflammation and the severity of what's going on. A lot of times your gastroenterologist will want to give you a biologic, but we want to try to avoid these harsh medications, and see if we can get your symptoms kind of resolved before we jump to the big guns. And then some additional testing would be an MRI or a CT scan just to make sure there's no scarring and to see involvement. And also an endoscopy would be important just to see if there are any active bleeding lesions, because those would need to be addressed with your doctor, and make sure that you're not at risk for bleeding out or bowel perforations, because those are really serious complications. And also you want to be aware that fissures can be associated with Crohn's disease, so you want to be always monitored by your gastroenterologist, and we can work in conjunction with your gastroenterologist, and they'll be informed on what we come up with today. So in terms of diet and lifestyle, when people are initially diagnosed with Crohn's disease, like you said, you want to do things very slowly at first and kind of listen to your body. When the inflammation has escalated to a point of bleeding and ulceration, you want to kind of stick to a bland diet. So a brat diet, bananas, breads, anything that's going to calm the inflammation down initially. Blended bananas, a lot of pre-digested food. So steamed broccoli, steamed potatoes, clean poultry. You want to avoid a lot of raw vegetables and roughage at first, because that can kind of move through your intestinal tract and inflame the already open lesions that are there. So anything that's digestible increases butyrate in your gut, which is feeds off the healthy fibers, but also very pre-digested. So blended, steamed are all good options, and avoiding raw. And if you are having an active flare-up, sticking to white breads, applesauces, tons of bananas, and getting the initial bleeding and inflammation under control before you start adding in any roughage. So soft fibers, and then while you're in that phase, adding in something like a VSL3 probiotic or fermented foods if you can tolerate it. Definitely no kimchi or anything like that nothing spicy, but you also can incorporate um, glutamine in the morning on an empty stomach, and that'll kind of help rebuild, and that's really important for people with Crohn's. Also, looking at your daily stressors, sleep is going to be very important, as well as high quality water. So water filters, maybe getting a Berkey, and really trying to get your stress lowered, because that's a huge contributing factor for all autoimmune diseases across the board. So things like mindfulness, yoga, therapy, and really gentle exercise, because you don't want to be doing a lot of HIIT workouts that can exacerbate inflammation, and really be hard on your adrenals and increase cortisol. And you really want to try to get your cortisol lowered so you get your body out of the fight or flight and into more of a relaxed space, so your body can go in and do the healing that it needs to do. And then we can talk about nutritional supplements, but really when you're in an acute phase of an initial diagnosis of something like Crohn's, you want to add supplements in very slowly. No antiparasitics, no antibacterial should be added in right away, because that can really inflame the delicate mucosa. So an omega-3 can be really good and an anti-inflammatory to reduce the inflammation. Like I said, glutamine, that kind of helps rebuild the intestinal lining. Probiotics, 20 billion colony-forming units per day. Also, Saccharomyces boulardii can be really good. That is a beneficial yeast, and that helps balance the flora. And a lot of times when you do have an IBD disorder like Crohn's, your intestinal flora is out of balance. Vitamin D, and that's great for immune function and overall inflammation. And you also want to look at, with the complete blood count that we're going to do, you want to look at the iron levels to make sure there is no anemia or active bleeding. A lot of clients come in that are bleeding and do have anemia. So you can add in something like a Floradix or something really gentle. I wouldn't advise an iron pill because that can cause nausea, but add in iron as needed, or your gastroenterologist can recommend an infusion of iron. Also something like a methylfolate to see if you well, first you want to see if you're methylating properly, but if you are methylating properly, you can do regular folate or methylfolate to prevent deficiency, because you are malabsorbed because of the Crohn's. You are not absorbing your food properly. And all of this should be done over a 3-month period of time, because it takes a while for these nutritional supplements to really take effect and to get your body back to homeostasis. So for your initial care plan, we want to look at you following back up with me pretty frequently. I'd like to do every 2 weeks, and this will span over a 3-month time period. We want to stabilize your symptoms, reduce inflammation, and address any nutritional deficiencies, really getting your body to digest and absorb properly. You will know when that's happening. We want to get you to having 1 or 2 regular bowel movements a day. For a prolonged period of time. So we'll know rather quickly if what we implement is going to help and or hurt you. And we'll keep an open line of communication for you to reach out to me if anything goes awry. So regular check-ins, we'll have you scheduled, and we can do Skype or in-person consults. And I do recommend scheduling a follow-up visit in 1 month to review your initial response to the treatment. And also we're going to look at all of your lab results, and we're going to discuss any ongoing symptoms. A lot of the times with Crohn's, new symptoms can come up and old ones can dissipate, or different things can happen based on the progression of the disease. So we really want to focus on long-term management and prevent flare-ups, and kind of get your overall lifestyle to a place where you're not experiencing symptoms, if at all. So we're going to do probably a C-reactive protein every 6 months, and follow up with regular colonoscopies and endoscopies to make sure there's no ulcerations anywhere within your small intestine and large intestine. As I said, it can actually be anywhere from your esophagus orally all the way down to your rectum. So you really want to look out for all symptoms, and they can be anywhere. So based on this initial consult, I'll prepare a detailed report and instructions for you, and we'll have that emailed over to you. And again, it can be challenging, but it can be healed, and we can try to get you into remission as quickly as possible. So follow up, and we'll be in touch.